Well, the paper that was published confirms the findings of many other studies in that there's an alarming increase in young onset colorectal cancer, particularly rectal cancer, over the last decade. As we've seen a fall in the mortality and incidence of colorectal cancer in the over 50 age group by up to 20%, we've seen a dramatic increase in colorectal cancer incidence and deaths in the under 50 age group.
I was 38 when I was diagnosed. At that point, I just had my son, he was probably 3. My daughter was 15, I believe, at the time. I was a fitness competitor. I ate well 85% of the time. So, I mean, who's going to think that I'm going to be sick in the stomach? I went to my doctor's for some other problem. I think it was because I was so tired. I couldn't finish a workout session. And going up and down the stairs, I would be literally stop at the top of the stairs and have to catch my breath. Okay, fitness competitor, that doesn't make sense. Go to the doctor's, I'm tired. I get a call 4 hours later from my doctor, and he says, you have to go to Bethesda, Maryland right now. We lived in Maryland at the time, southern Maryland. Took 2 hours to get there. I stayed overnight, and they did a whole bunch of tests, and that's when I found out.
Well, I think the paper really has 3 major suggestions, which is number 1, the importance of family history or underlying risk factors cannot be understated. And these need to be not just identified, but identified at the proper time. So identifying these later in a strategy where we think 50-50-50 really is too late. And so it speaks to the focus of an important topic-based conversation between a physician and the patient about this. And again, 75% of these cancers occur in the under 50 age group between 40 and age 50. And so as we have a discussion about what that proper age is, I think that we have to focus, though, that a communication strategy focused early is important. So that's number 1. Number 2, it's extremely important that people understand that the symptoms of colorectal cancer are very similar in the 40 to 50 age group or even younger as they are in the over 50. Anemia, unexplained abdominal pain, particularly rectal bleeding. The majority of these cancers are in the left part of the colon, the rectum and the left colon, and so they're going to present with some of those classic symptoms. All too often, people are either delay treatment and evaluation by the physician because they think 50 is not the time. And likewise, physicians sometimes delay diagnostic testing. So I think the second take-home message is you have to promptly evaluate these symptoms both as the patient and as the provider. And finally, the third issue is that really more education is a great idea. We know that even though mortality for the over 50 age group is declining, that 50 to 55 5-year segment is really flat. And so again, it speaks to the fact that their disease probably began in their late 40s, but unfortunately wasn't diagnosed until then, and therefore we're not making that. So I think the real shift in the communication strategy to address this issue, to support better the current screening strategy, really to me are the 3 take-homes.
And like I said, you are your best advocate. You know your body more than anyone else. I don't care how many years that doctor's gone to school. If that is not your normal, then that is not your normal, and you need to let your doctor know about that.
Most importantly, though, if you're having problems and your physician is not connecting with you and recommending the appropriate testing, you should either ask him directly and specifically, and if that fails, then I think you should feel free to get a second opinion. I think you should, again, it's your body. You're going to have to deal with this. We know that diagnoses are delayed based on this study, and so don't let that happen to you. Well, I think in the research arena, there's really 3 areas that need to be evaluated. Number 1, we need to understand more about the biology and young onset colorectal cancer. That's clear. Number 2, we have to understand how we shift what we all accept as everybody needs to know about their family history at age 40 and physicians should talk about it. Well, we need to study the behavioral issues and policy pieces that need to come into play to make sure that is a reality. And then finally, I think that we need to model screening strategies based on young onset colorectal cancer information that we've provided and that other folks have confirmed, so that earlier screening strategies can be evaluated to best serve our current guidelines.
Well, the Colon Cancer Alliance wanted to be responsive actually to the rising demand within our patient community. Overwhelmingly, we have people involved with our organization who were diagnosed under 50. So they were first leading the charge, but then also the science is indicating that they were on to something. Well, if we can actually see a decrease in the number of people with late stage diagnosis, we'll have felt like there was a huge success that we helped contribute to.
So by bringing this conversation to an earlier population, I think that you're going to have major effects in screening both high risk, symptomatic folks, as well as those folks who are normal risk in the future. So I think the Colon Cancer Alliance and its partners are doing an amazing job of making sure that this issue doesn't go away.